So the commission itself brings together experts and former government officials, public health officials, folks who are experts in disaster mitigation and response, folks from the education world, and then also the faith community. And we're going to be meeting a bunch of times over the next couple months, and we're going to be issuing an interim report at the end of this month to provide some recommendations. And then we'll be issuing a final report probably sometime in early June.
You know, I think the British have approached this crisis with the spirit of a warrior nation that is not going to be defeated. And I think that Boris Johnson in many respects embodies that. And even though he has the coronavirus, he's still working away in behind the scenes in Downing Street, largely by video conference. He continues to inspire the British people. I think that, you know, British leadership is very powerful at this time, and we need to have a strong Britain on the world stage. This is also the Brexit era as well. Britain's just left the European Union, and I think that Britain will be, you know, a shining beacon of liberty and hope, I think, across the world.
I think that they represent, in some ways, the best of America, because they bring the experience of care and responsibility, of discipline, of organization, of commitment to mission, and they work well with civilians. The COCOM, especially Northern Command, which is tasked with protecting the home front. So I think this is expected to happen, and it's happening not just in New York. We're seeing in Dallas and New Orleans, Seattle, the coming together of civilians and military to save our nation and to protect our people.
Also, South Korea implemented a very extensive testing program. They were doing 10,000 to 20,000 tests a day on citizens, when even months later, weeks later, the U.S. hadn't done 10,000 cumulatively. So they had drive-in testing areas. People would get results within a few hours, and now it can be within even shorter than that. And so they were able to produce these kits with a lot less bureaucracy, a lot less red tape than it seems in the U.S.
Well, there's been a flurry of what I would call regulatory relief or action by policymakers to clear away any underbrush, if you will, of government policy that's getting in the way of people using telehealth or telemedicine, particularly during this pandemic. So the examples you cited are two of them. When I was preparing to talk to you today, there's just so many, it's almost hard to keep up. A really big one that really will matter a lot is that the administration decided that if anybody is in Medicare, or if a state wants to opt in, anybody in Medicaid can see a doctor regardless of where that doctor is located.